Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu of Rochester Chiropractic, broadcasting live from our office in downtown Rochester. And we have a special guest tonight, and we will every Wednesday. Dr. Jeffrey Haddad of Rochester Advanced Dentistry will be with us tonight to answer questions concerning Mercury amalgam fillings specifically, and the pros and cons of removing them, replacing them with safe material and more superior material, but as well as safely replacing them, because that can cause heavy issues too. And anyways, if you have any questions regarding Mercury amalgam fillings, or if you're thinking about having those out, please give us a call at 313-838-1035. And I would just like to say, as always, that the Lord's people suffer and perish and are destroyed for lack of knowledge. And that's what we hope to do with this show, is that the Holy Spirit would guide our words and our thoughts and open the hearts of all the people listening out there to become more educated to the subtle things that are actually diminishing our health. We always talked about interference. We're electric. Our brain, our spinal cord is electric. And there's things that boost our energy and electricity, and then there's things that cause interference. And one big thing is the amalgam fillings. So anyways, Dr. Jeff Haddad, welcome to the show again, and I really am honored and blessed that you're here tonight.
Thank you. I love being here with you, Dr. Joe, and I'm excited about tonight. I know this is a topic that you have been excited about to get to for a while.
I've been chomping at the bit, so to speak.
Very good, good. No pun intended there. No, this is definitely a controversial topic in and outside of dentistry, and there's a lot of reasons why I don't use this material in my office. I haven't had it in my office, ever. I haven't placed a silver mercury filling since dental school. And
good for you.
There's just better materials out there. And, I know you want to get to the health risks and these potential problems, and I promise you we will.
Yes.
I think that's a whole show in itself.
Yes.
So I think today we'll probably concentrate just really on better choices and why having these silver fillings in your mouth really for too long could end up being a real big problem for you.
Yeah. So tell us specifically the amalgam fillings. What is the amalgam? I'd like to say mercury amalgam. I know they call it silver amalgam, but
well, no, it is. Listen, it's interesting because the silver amalgam is a little misleading because 50% of it really is mercury, and the rest of it.
So 50%. Did you listeners hear that?
That is
so.
True.
50% is mercury.
Correct.
Okay.
Correct. So
can I call it mercury? Since usually when you read ingredients on something, the thing that it's most is the first thing that's written, right?
Absolutely.
Now tell me, so let's say mercury, you know how toxic mercury is. If you drop the silver mercury filling in water, let's say you dropped a couple, how much would be toxic if you dropped it into a bucket of water?
Well,
would that water then be a gallon of water?
Oh, you're leading me down the path there. From what I understand, if you took 2 silver mercury fillings and put it into a 10-acre lake.
A 10-acre lake.
Then due to EPA guidelines.
So you're talking about
everything,
thousands of gallons of water. Just 2 fillings.
That's correct.
So most people have at least 2 fillings in their mouth.
Well, absolutely.
Okay.
That's the norm.
So you take 2 fillings, throw it in a 10-acre lake of thousands and thousands of gallons.
Right.
Well,
the amount of mercury is in there. Now, however, I'm going to tell you.
This is the FDA, too, right?
This is true. This is true.
Rogue chiropractor who's a little.
But this is true. No, but the rogue chiropractor is trying to go down the path 1 week early. But really what it comes down to is whether or not that mercury, once it's combined with these metals, is it still poisonous? Is it still leaking? And again, these are all a lot of questions, and there's some unanswered ones, and there's a lot of reasons why somebody, in my opinion, should use different materials to restore a person's teeth. We talked last week about technology and the latest and the greatest.
Right. Right.
And this is a material that was used in the Civil War, Joe.
Ouch.
And I mean, how many physicians do you know would be proud of a technique or a material that they were using in the Civil War?
In the Civil War.
Not many.
Not
and
many.
Yet
you talk about hip replacements. What I try to do is postpone it. With some of my patients, it's inevitable. You have to have a hip replacement. But if we can postpone it for 6 months, the techniques they do today, they're not going to be using the same materials.
Absolutely.
6 months.
Absolutely.
So you're telling me they've been using this since the Civil War.
Yeah.
I'm not proud of some of the techniques chiropractors did back in the 1800s and 1900s. We progressed so much. So, this is a material. So number one, it's an old, outdated material.
In my opinion, it's obsolete. I mean, it really is something that I wouldn't even consider putting in my mouth, my family's mouth, any of my patients' mouths, because there's just so many better options. And when it comes down to choices of more natural, more conservative, stronger choices to restore a tooth, then I will. It's not even in my toolbox at all.
Not in your toolbox. Hey, Dr. Haddad, we do have a caller, Angelina, who has a call about dental implants. I hate to, butt into your flow.
Oh no, that's fine.
Hey,
that's fine.
Angelina, hi. You're live and on the air. Did you have a question for Dr. Haddad?
Yes, sir. And how are you doing? I'm the one that was suffering with the hives also.
Oh, yes.
I'm better now, but
good.
I was actually calling for my son for sinuses, but then you guys brought up the Mercury about. I have 4 implants that they place at the U of M in my mouth, and I have 1 more scheduled. 2 are successful. One of the implants was, when they placed it, they cracked the bone, and it got infected, and so they had to redo some type of surgery, and they said it's okay, but I have also 1 more that my tooth decayed, and now they're waiting for, because they did the bone grafting, and now I'm waiting to get that implant. But I've been having... and it's only on the right side. All this happened on the right side. That recently extracted the tooth to get it prepared for the implant. Did the what is that called? The mold. What is that? Bone graft. Excuse me, bone graft. And I'm having problems, almost like on the face nerve, almost like nerve damage. I get bouts of zingers, they call it, like shooting pain at that area. They've taken x-rays. They haven't found any infection in there. But then I get, on the right side, also on the top of my head, headaches. And I'm not sure what's going on. And I'm wondering, is there any symptoms or side effects to implants or...
No. Angelina, I'll tell you, obviously this is just from your description of things, but it almost leads us back to what we talked about last week. Obviously you've lost some teeth. Sounds like it's mainly on your right side. When people have teeth being lost broken down over years. It's not, we got to stop thinking about teeth here. We got to think about the entire mouth and how your jaw and your bite comes together. It sounds like to me you have some possible symptoms of a TMJ situation, which we discussed last week. You know, your bite is very important to you. And yes, you're having the teeth replaced, which is great. And a dental implant is an excellent, excellent option. Probably one of the best options to replace a tooth. However, if your bite is out of balance prior to them replacing these teeth and you are having trouble relaxing your muscles, because we talked last week, 90% of headache sufferers and TMJ sufferers, it's 90% muscular in origin. This could really be some of the things that
top of my head and on the right side.
And that's exactly, this does not have to be a symmetrical thing. You could have it on one side of your head. You could have it on the back of your head. These are all symptoms of an overall bite issue. So if I were you, I would definitely, you're at a great place, University of Michigan, my alma mater, go blue. You are in the right place, but you need to let your doctors know these symptoms that you're experiencing, because this doesn't sound like it's related to your implants and more about the overall balance of your bite. So thank you for calling. I appreciate it.
Hey, Angelina, tomorrow you could call in with the sinuses.
Sounds good. Angelina,
that
thank
issue.
you.
Hey, stay on the line stay listening and thank you for calling, Angelina. I want to hear from you tomorrow. So, Dr. Haddad, on that line, I know we're going to segue right back into TMJ for Angelina's sake. Mm-hmm. Okay? So now she's so what we try to do too is to treat the root cause of the problem and not treat the symptom. I think that was great what you said. The teeth are falling out, but we need to find the root cause.
Correct.
Plus, if she's going to get implants, I know for me, I have patients who've had knee replacements, but then it's their feet down below. They'll wear out their shoes and their heels are all worn out on one side,
Absolutely.
right? And it just makes a rattling bucket of bolts out of their knee replacement. So they'll still have a knee. And it's like, why didn't the surgeon who did the knees, he just looked at them at the knee.
Right.
He didn't look above to the hip, and the feet cause so many knee problems. And it sounds like with Angelina, if she gets these implants and her TMJ is off, that's not going to really solve the problem. There's going to be a problem in the future for that.
Well, it's funny, a lot of and this is really the way a lot of dentists are taught. We're almost tooth mechanics, and a person comes in, a tooth breaks, and we fix it. I learned just many, many years ago that I want to know why that tooth broke. Sure, fluky things can happen. You come down on an almond or something like that. But when you start seeing a lot of repeated fractures, whether they be silver fillings and broken,
or if it's just on one side, like hers.
Exactly. I mean, something is going on there. And so I love that you talked about shoes. That is a perfect example of posturing your body. Well, that's exactly the way that we treat it. These TMJ sufferers are muscular pain patients. And I was taught, and the majority of dentists are taught, to disregard those muscles.
Disregard.
But you treat
the muscles, what percentage of the problem?
90%.
90%, and you're going to disregard.
I know, and it never made sense to me. So we're taught to treat the teeth and the joints. Well, that really didn't sit well with me. So my partner and I sought out, better approaches, different, newer technologies and training, and we take what's called a neuromuscular approach to dentistry, which means that we use the patient's actual body with instrumentation that we have that measures their muscles. We relax those muscles, what's called a TENS machine, which we talked about last week. This actually gets the lactic acid buildup out of the muscles, brings them down to those comfortable and healthy lengths that you deal with every day.
We want a peaceful, easy muscle.
You got it. You got it. And then once we have that position that we can measure with our computer, we need to support that position, and we support it with exactly what we just talked about, an orthotic. And not an orthotic for your shoe, it's a jaw orthotic. And it is an appliance that's worn over their lower teeth that really mimics the way that their bite either should be based on their comfortable muscles or maybe where it was 20 years ago. Angelina guaranteed did not have the bite she has today, especially if she's lost teeth.
Right.
And it sounds like she's having pain now, but wasn't, say, 10, 20 years ago.
Right.
Bodies can adapt only so much. They get pushed over the edge, and then, unfortunately, they end up in my chair, and I need to resolve that and get them back to that comfortable posture.
What other equipment do you have to analyze, like if she came to your office having headaches or ringing in the ear, tinnitus, those things?
Yeah.
What is the equipment that you have?
We have what's called a K7 jaw tracking system. It's literally a real-time computerized jaw tracker that I can look on screen while the patient is moving their jaw to any position. I can see the muscles as they move, and I can determine their most comfortable, lowest muscle activity so that I can keep them in that position and keep them comfortable. If I can keep that relaxed position, which unfortunately is an involuntary position at this point. You have bad habits, Joe. So do I.
Right.
People who clench and grind, people who have bad bites are bringing their teeth together 1,000 to 3,000 times a day.
Wow.
Every time they do that.
It's a lot of repetition.
Absolutely. And, every time they do that and they bring themselves in that destructive bite, that tension is there. We need to get rid of that tension. So we use that TENS machine. We relax those muscles. And then with the computer, measure the exact point. We're talking tenths of millimeters here. And we support that position. I use this analogy with women, and they understand it. It'd be like running around in heels all day. Eventually, your calves and your thighs are going to get pretty sore, okay? Or more importantly, if they're on their tiptoes, running around. We need to support things in there. And a lot of people's back teeth are not supported properly because of grinding or old dental work or loss of teeth or orthodontics. And we need to get them back to where they were 20 years ago, 10 years ago, or maybe never. Some people are born with bad bites, but we need to find what their body is telling me is the most comfortable position for them.
Huh. Now, so, Jeff, I love the equipment you have in your office, and that's why I really sought you out. Of all the hundreds and hundreds of dentists that I know and are patients of mine. But what percentage of dentists have this equipment that you have for the TMJ?
Well, the training, it's not just the equipment, it's the training.
Okay.
I started this curriculum over 10 years ago. And the doctors that are out there at this level, there's less than 1% of the dentists in the world that have gone to this extent. And again, it was a choice I made. I'm
of really understanding TMJ.
Exactly. And
because this is so complementary to chiropractic, and chiropractic is to
absolutely.
TMJ, right?
No,
where
for
if the
sure.
bones in your neck are out of place, causing muscle tension, pulling the jaw out, or is it the jaw pulling the neck bones out? We adjust them, and then they don't stay and hold.
Correct.
So,
correct.
Anyways,
and I'm glad you bring that up. I mean, you do an excellent job, and I just met a patient the other day who has been seeing you for a very long time, unbeknownst to me, and she's been comfortable for many, many, many years. If people continue with that, the adjustments and seeing you, they're going to be healthy. But some people, like you just said, your adjustments don't hold. They go into their bad habits, and there's nothing you can do because you're not following them home and keeping them adjusted.
Right.
That's where I would come in. After adjustment of yours, I can support that jaw in this position that I've measured and proven, and it allows your adjustment to hold. It allows my jaw to be supported in my patient, and the patient gets well very, very quickly. And predictably, too, which is nice.
Predictably. That's super. So, anyways, we talk about balance, and it sounds like she's definitely out of balance.
Absolutely.
As many of us are. And having balance and symmetry is so important so we don't wear out prematurely. And I love the fact that if we always, as chiropractors, we talk about finding the root cause of the problem, but guess what? Sometimes chiropractic and adjustments is not the root cause. It is the TMJ or your shoes or what. There's a problem elsewhere.
No, absolutely. I tell my patients a lot. I don't need to be the hero to fix them. I utilize a lot of great people, yourself being one of them. And I need help sometimes, and the main goal is so that the patient gets better. And sometimes it's a multi approach from different modalities that gets the job done.
Multidisciplinary.
Absolutely.
Yes, and sometimes a patient will be going to physical therapy, and the physical therapist will, well, if you get better, well, I don't know, was it me or was it the chiropractor? So just go to. It's like, wait a minute, guy. I love that you're able to work with me, that you and I consult over patients and we work as a team.
Absolutely.
Because whether it was you or I or the combination, is the patient better? Hooray!
No, absolutely. Well, I hope people aren't mad that we got off topic there.
Yes.
In all seriousness, if people are listening today and they do have any questions, I've put a lot of time into our website that gives a lot of information. It's RochesterAdvancedDentistry.com, or you can call our office.
Angelina, I hope you heard that.
Yes.
I want you to check out RochesterAdvancedDentistry.com, or just call Dr. Haddad at 248-656-2020.
Correct.
That was 248-656-2020, because if you have a problem with your TMJ that's really causing this tooth problem that you're having to fail, wouldn't you at least like to know to come in? Jeff, can you give her a hand if she comes in, or if any of our listeners call you from tonight?
No, absolutely. We have, if anybody calls and they want, information, they would like a consultation, mention the radio show. The ladies at the office, know what to do, and they'll take good care of you.
Thank you for doing that, because I know you're busy. You don't need to do.
Well,
I appreciate you.
Thank you, and
being here.
It's my pleasure.
And your commitment to being here, as we talked before we went on the air, that this is part of our tithe to give back and to try to educate people to save lives.
Yeah. No,
and improve lives and
absolutely
prolong life. We want to prolong life, emotionally, spiritually, and physically too.
Well, and a lot of patients, and even back to the amalgam debate, they don't know any better. It's our job to educate them. I may talk too much to my patients, they may say, but at the end of the day, they are going to know every option that is available to them. And whether they choose it or not, I'm going to give them my recommendation, but it's their choice in the end. I don't push people in any direction. I'm going to give them the risks, the pros and the cons of anything, and whatever they decide is fine. But if they have the information, 9 times out of 10, they make the right decision, but you have to give them the information.
Great. Hey, so, getting back to the amalgam, and I know you probably don't want to address this a lot tonight, but you know me.
Yeah.
I want to know, what are the health risks that you have heard about?
Okay.
Give us some nuts and bolts from the American Dental Association or the FDA. What are they saying?
Well, they're not saying that there are any risks, as you know. I mean, this is a very political, and it's a very touchy subject, to be honest. And unfortunately, or unfortunately, there really aren't any concrete studies either. But there's also common sense. And, we talk about mercury being poisonous and all, and in nature and the environment. And just recently, we talked about the article that came through for Fox News last week. They're actually starting to put a treaty out there that will tell dentists to ban this material in the United States. There's been 3 other countries that have done it: Norway, Denmark, and Sweden. Are we next? I don't know.
How long ago was that?
That was in 2009, I believe.
2009.
Yeah.
Okay.
And so
they finally came out and said it.
And again,
I realize if the American Dental Association said that, there could be lawsuits. It could just open up a whole can of worms.
And I'll tell you, in the ADA's offense too, there is no actual concrete evidence either. But it looks like, in my opinion, things are being phased out. And again, whether it's because of the potential health risks or whether it's because we just have better materials that we really didn't even get to today and we can talk about next week, there's just better options for people. And I just want my patients or anybody listening to know that just because a big old silver filling isn't hurting you or falling out of your head does not mean it's not failing. Please know that when it hurts or breaks, it's too late. Then we got to do something that's a lot more aggressive.
Okay.
If we're proactive, we can be conservative. We can be conservative economically and procedurally.
Okay. Hey, I'm going to interrupt you again.
No,
we have
a
caller, Christine. Hi, Christine.
Hi, Christine. How are you?
Good evening.
Good evening.
I
Okay.
have a question for Dr. Haddad. I heard him saying something about when your bite's not right, that he can make an appliance for the lower teeth.
Correct.
And I have a bite guard for my upper teeth because my bite is off. I've had one of my back molars removed. And I get the same thing as your other caller does, where I get like the vibration, electricity to one of my teeth.
Right.
And I'm wondering if maybe I could benefit from what you were saying, that appliance that goes on the bottom versus the top.
You know, Christine, I'll tell you, what you're wearing is really more of a protective appliance. I'll tell you, I wear one. I'm a big grinder, and I wear one every night on my top teeth, just like you. The difference between your appliance and the appliance that we make is that it is flat plastic, and it's just preventing your teeth from coming together. Our appliance actually is going to support your bite in an actual position. It actually looks like it's got little plastic teeth, if you will, on the appliance, so that when you come together, it's mimicking the way your teeth should be coming together in a balanced position. So, you know, if you'd like, and again, my goal for any of this is to make sure that I'm not wasting your time as a patient or my time as a doctor. And if you're interested in seeing if you are a candidate for this, please feel free to give the office a call. Like I said, I'd be happy to take a look at you. I can tell you that day if you are a candidate for this type of therapy.
Okay, and now would that require that appliance to be worn like all day long, or is it night, or is it different for every patient?
It's different for every patient, but a lot of times, very good question. At the very beginning of therapy, it is as much as 24/7, as much as can be worn, but it does vary with each patient and each situation.
Okay,
Great question.
Last question is this covered by dental insurance, or does TMJ?
Yeah, that's a great question.
Insurance?
Unfortunately, dental will not touch it, and most medical insurances don't either. We will, as our office does, we will submit things to your medical. Sometimes you will get some benefits, but we never tell anybody to count on it, because I would never want you to count on that in the end.
Okay.
All right.
Well, thanks for calling, Christine.
Appreciate it. Thank you for the call.
Have a wonderful night. Yes. So anyway, in the recap, these Mercury amalgam fillings they might be cheaper to use at first, but then they can crack teeth, and then you need crowns, and it's expensive later on, let alone health problems, right?
Being proactive is going to actually save you not only time, money, but tooth structure in the end.
Yeah,
so just
really,
be proactive.
The bottom line is try to have your mercury amalgams replaced somewhere down the road. We'll get to this next Wednesday, okay?
We have a ton to talk about.
Now, for tomorrow's show, yesterday we were talking about the liver cleanse and lemons, and we are going to really hit on the gallbladder cleanse tomorrow night. And I want to tell all of you, thank you for listening, and remember that in all that we do, eat, or drink, do all things to the glory of God. Have a blessed night. See you tomorrow evening. Bye-bye.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.